thank you. Thank you for coming. Thank you for joining. Especially both of you have been traveling to come here to Boston today. Sharon, you came from California, and Dr. Weiss, you came from Germany, Berlin, through Iceland, if I'm not wrong. So thank you for being here. So let me start with the first question, which is around, tell us a little bit more what you do to help communities with the use of virtual care, technology, in their moment of need during crisis. So maybe let's start with Dr. Weiss. Can you tell us a little more about the experience within Charité, please?
Yeah, of course. It's my great pleasure to be here, and guten Abend, as we say in Germany. So, yeah, it took us 2 days to have a German on stage. Okay, let me take you back to 2018 when we started our telemedicine journey. We actually did a stepped wedge cluster randomized controlled trial, and we wanted to show that telemedicine is able to be a vehicle to transport quality of care to intensive care communities. And then suddenly the pandemic came, and believe it or not, people were not asking for telemedicine robots. At the very beginning, they were asking for ventilators. They wanted intensive care capacity, and we began to realize very, very soon that the pandemic is not a local problem, but a global problem. And we were suddenly facing the challenge of the globalized world, the challenge of a pandemic. And when the second question after the ventilators was the question of how to get the evidence, the knowledge, the medical knowledge, the new knowledge we have to the bedside of patients. And this is where we could help, and where we actually used the experience we made during our ERIC project and scaled the ERIC project and served our local community in Berlin and the surrounding areas. This was when the German Public Health Institution, so the German CDC if you want so, realized that this is a great opportunity, not only for Berlin, but also for other regions in Germany, and potentially also for communities all over the world. And this is when we did something like a test balloon and started telemedicine programs in South Africa, in Central Asia, Uzbekistan, in the European area in Montenegro, and now we scale to Uganda and Ukraine also, to help people in crisis, because I think that is really something that is extremely important. Equity in medicine does not only mean equity in your own healthcare system, but especially in developed countries, it means also serving those who do not have the same opportunities. And yeah, this was our starting point when we started to work international.
Yeah. Thank you. So, Sharon, with WTI, you have been helping all around the world, from Asia, Africa, Latin America. So tell us a little bit more what you do with the World Telehealth Initiative.
Sure. World Telehealth Initiative provides quality health care for those that undeniably need it most. That may be refugees that haven't assimilated into the healthcare system of their new host community. It could be those suffering in areas of conflict like Ukraine, or it could be those simply living in remote areas that don't have access. An example of that would be one of our programs in Opoji, Nigeria, is probably our most remote program. And previous to our program launch there, the closest hospital is 38 miles away. And that doesn't sound like a great distance. But when we realize that their only means of transportation is either by foot or by bike, suddenly that becomes much more of a barrier. So we are able to serve these communities that otherwise, we were told, if they received a diagnosis from a clinical officer that rotated through their village, they would simply go home to die. And the reality is that doesn't have to be that way in Opochi, Nigeria. We can support them. We can bring the medical expertise to those communities. So we do that by the incredibly generous donation from Teladoc Health of this advanced telehealth technology. Then the technology is really powered by a network of philanthropic physicians that are volunteering their time and expertise to beam in to these low-resource communities. So right now, we are in 33 communities, and that goes across over 12 countries now, those in Asia, Africa, South America, the Caribbean, and now Eastern Europe. And so we're able to provide the services that they so desperately need, thanks to this incredible technology.
Thank you. So we have been discussing that all of us related to virtual care, we are trying to help patients get better access to healthcare. But somehow, while you do this in these critical moments, crisis situations, is more than that. So there's an impact in the community, and there is a multiplier effect, which goes beyond healthcare, education, and somehow improving all the healthcare system within the country. So can you elaborate a little bit more about the impact that you have in those communities?
Sure. So when I think of the impact, maybe it makes most sense for me to ask you, just imagine, put yourself into the position of having a heart problem, and there is no cardiologist for you to consult with. And maybe your primary care provider or whatever clinician you are able to see doesn't know the extent of your problem. Or maybe worse, what if your child was suffering and there was nobody to care for him or her? So the impact, one case that was just recently came to WTI was there was a baby born with a condition that nobody knew what it was. Her legs were extremely swollen and her feet were almost deformed due to the edema that she had. And she was now 6 months old. Her parents had left her. She was under the care of a assigned caretaker, and they brought her to the hospital that was partnered with World Telehealth Initiative. So they first requested to see a dermatologist, and he quickly said it wasn't under his sphere of influence. So we were able to match this baby in need to an infectious disease, a pediatric infectious disease expert. And he thought he knew what it was, but the amazing thing about the World Telehealth Initiative network is that that picture and his findings went out among the network of providers. And we had pediatric surgeons and other infectious disease experts weighing in, all considering what is in the best interest of this 6-month-old baby girl. And then not only were they evaluating what could be done in high-income countries, but also giving solutions that if that baby couldn't access, a surgery that she needed, there were ways to manage her condition that required compression and massage. So this baby's life is dramatically altered due to all that expertise that was shown towards her through programs like WTI. So the impact obviously can be enormous.
It is, and following with that, it's not only the impact, but also the learnings that you have from one experience that you can apply to the next experience, and I guess many of which can be applied in our day-to-day as a virtual care organization. So, Dr. Weiss, can you tell us a little bit more about this concept of how you keep learning by helping in those different missions that you are doing?
Yeah, it's definitely the case that it's not only our spoke sites learning from us and doing medicine on a peer-to-peer base. So the impact is definitely that I think we are saving a lot of lives together everywhere in the world. We are giving our little contribution to equity in medicine. But I think it's also really important that, especially taking the example of the pandemic again, that we can learn a lot from those communities in terms of clinical management. I mean, we are doing the telemedicine program in South Africa, in Pretoria and in Cape Town. And as you might all know, the Omicron variant that hit the world during the first half of this year emerged actually in Africa. And the first cases that we saw were actually cases not in our own hospital, but cases in South Africa. So we could learn that Omicron is causing less pulmonary infections, but is putting stress on the system because so many healthcare workers were found sick and could not come to work. So I'm really thankful that those communities also contributed to us, and it was not only that we contributed to them. Regarding impact, I would also say it's really important that telemedical programs are giving digital impulses to these communities, and they need them so much because the inequity in these communities is often much higher than in our healthcare community. And as we heard yesterday, telehealth is able to reduce inequities, and showing them how this works, how this can work, and starting something like a pilot program in these countries might be the first step into a digital future.
Yeah, and thank you for that. Somehow, well, you have implemented many virtual care projects and missions around the world. You do it in moments that are stressful and where need is needed very fast and with difficult conditions. So I wonder how you do it, how you quickly mobilize operations, how you get the right stakeholders to provide support. How do you have this balance of what can you do fast and what maybe it's not possible to do fast? So, following with the last question, can you elaborate on that, please?
Yeah, Carlos, this is a great question. You all know the Germans, we have invented administration. Yeah, we love it. We think in little square boxes, and so unexpected circumstances, very bad. No, but yeah, but this is something. I mean, you all know. I mean, you are experts in telehealth. You know that it takes a year or more to implement a program. You need GDPR, finances, technology. You need to train, etc. And if you go to a different country, there are other determinants you have to consider. It's a different culture. It's a different healthcare system. People are doing different things. Medicine is not medicine. So it would take even longer. So you have to overcome your inner German, and you have to be brave, and you have to do what is necessary, but you should not do more, You should not overload the system with bureaucracy, but you have to help, and the fastest implementation of a program, and this is also a great thanks to Teladoc, who supported us massively with that, was our program in Ukraine, where it took us 4 weeks from the request to our first teleconsult.
Thank you for that. And well, the same for you, Sharon. And we were talking before the session around you basically take the decision to travel to the places you are helping people. And because you think there's more than helping, you need to connect with them to make things happen. So tell us a little bit more about that.
Sure. Well, fortunately, I'm not fighting an inner German in myself, so we have that going for us. Secondly, We had not responded necessarily in a crisis situation before Ukraine, but we did prove that we are able to quickly mobilize. And part of the reason we were is because we have this established network of hundreds and hundreds of providers that have already raised their hands, and they want to help, they want to serve these communities in need. So then WTI is what we do is we make those matches based on this algorithm we've developed. What are the languages we need? What are the medical specialties they're requiring? So in Ukraine, we were able to quickly put those pieces together. But to your point, I will say that WTI, when we did set up very quickly in Ukraine, but all of our programs are designed to be long-term, to support these communities for as long as we're able to provide value. And that is the same in Ukraine. We do like to establish those relationships and deepen our involvement within their community and make sure we're supporting them in the ways that they need going forward.
Right, and I imagine that all of us in the virtual care space, telehealth, hospital systems, health plans, institutions, we face a lot of challenges. It's not only regulations, but many challenges. So, but again, in your case, there's plenty of challenges, and you need to overcome them with limited resources in a very fast way. So tell us a little bit more about those challenges, whether in Ukraine or in Africa or in any of these different situations. So maybe, Dr. Weiss, if you can elaborate on that.
Yes, as I alluded to, determinants of global health, of telehealth and global health, do exceed the normal determinants you have for a success of a program. I think it is very important to consider the healthcare system you are working in, to consider culture, religion, beliefs, medical practice. That's very important, because if you don't do this, you cannot be successful in a community, because you have to understand what they're doing, and I'm not the one who judges whether or not this is what I would do. This is a very important thing, and this is a challenge, and this sometimes can be something that takes time to learn. Yeah, the second thing is Wi-Fi. You need Wi-Fi. That's something that sounds a little trivial, but in the end it's really important that you also consider this. And thanks to our creative solutions, we found Wi-Fi in any place so far. So we were in a field hospital in Tashkent, outside Tashkent, a COVID hospital, where we really digitalized the hospital, not only in terms of putting a telemedicine card there, but also establishing a real Wi-Fi connection, which also, by the way, helped a lot of doctors outside the telemedicine to ask the questions to their fellows. Because imagine you are a neurologist and there is a COVID surge, and there are 6,000 or more patients in a field hospital, and you should care for them. I mean, the first thing I would want is a functioning mobile phone to ask all my colleagues for help, right? Because I will have a lot of questions regarding pulmonary and critical care, and Wi-Fi, I think, is an important thing. So back to your question, I think it requires some kind of cultural sensitivity and strong partners.
Mm-hmm. Yeah. Sharon?
As far as unexpected circumstances, so of course we all went through COVID, and that was unexpected. And for example, in Bangladesh, we were doing a lot of pediatric care and family medicine. And with COVID, first of all, those patients stopped coming to the clinic, but we had to rapidly pivot. All of a sudden, they were requesting pulmonologists and anesthesiologists and respiratory therapists. So that was something we didn't foresee. And when these requests were coming in, that was kind of at the height of the US surge, the first surge. And so I was fearful that the US providers that are in our network would be unavailable. But the amazing thing is these providers get such fulfillment from these engagements that beyond their 16-hour days, they wanted to continue supporting these communities. So what we thought would be an enormous challenge actually wasn't as bad as we had thought, and we were able to provide the solutions. But in general, part of doing business, on a global stage is there will be challenges, and some of them are country specific. One of, an example of that is in Nigeria. We were able to ship the devices and they cleared customs without too much problem, but then they were sitting at a storage facility, and we were talking to our partners at the clinic, and they said, we haven't been able to get the devices because there's robbers and bandits on the road, and it wouldn't be safe to transport these devices to our location. So we waited for a couple of weeks, and then they were able to engage the Nigerian army to do this absolutely covert mission. It was in the middle of the night, and they covered the devices and had armed soldiers escort those devices, to this very remote village. So yes, we do experience some challenges, but lo and behold, WTI, due to our partners, our supporters, our incredible staff, we are able to rise to the occasion, and the challenges haven't stopped us, and nor will they.
That's great, thank you. So we are getting to the end, and let me make a last question, which we as Teladoc we have been involved in many of these situations. I remember when we were providing support to our own employees in the region, in Ukraine and Belarus, or when we were providing support in India to populations and communities that had need during COVID-19. And what I think we were amazed, I was personally amazed, is that you always find a lot of people that wants to help. It's amazing, the amount of people that is willing to support. But it's not so easy to tell them what they can do. So the next question would be, what advice would you be given to those that are looking to help in these situations? So maybe starting with you, Dr. Weiss.
Yes, you can always send me your application, and I'm happy. No, yeah, you can do that. But I think the most important thing is that you look at what you are doing, and you think about how you can actually use what you are doing also for other communities, right? You have to think a little bit bigger, and I think the telehealth community has the power of really changing the world of healthcare and leading us to a better future. I mean, we will not be able, we are living in a globalized world, and we will not be able to travel everywhere, right? We also have to take care of our CO2 emissions. If there is a pandemic, we have surges in our own countries. So of course we cannot be at 2 or 3 places at the same time. But telehealth gives us the opportunity to overcome these challenges and to add a little bit more of equity and fairness in healthcare. And this is what I'm really devoted to, and I hope that other people will just follow this pretty easy example and do the same. Yeah, that would make a huge difference.
Mm-hmm. Sharon?
Well, for WTI, I would first of all say, if you are a clinician, volunteer your expertise. Let's get you in our network, and we provide meaningful opportunities for you to engage in these experiences. It's very simple, from your home or office, on your schedule, maybe an hour a month or so. So volunteer with WTI. Second, I would say, join our mission, donate to WTI, continue enabling the work that we're doing. And lastly, that I invite each of you to do is sign up for our newsletter and become one of our community of supporters. and follow the work we do, stay in the loop, and all of those can be done at worldtelehealthinitiative.org.
Thank you so much. The work that you are doing is amazing. Congratulations for that. Really appreciate, and you become a reference, a role model for so many. So again, thank you. And so I think with that, we can conclude the session. Thank you so much.
Thank you.